Tadaxicano Foods presents a Local 3 News special program. The UP fights breast cancer. Sponsored in part by Kirkish Furniture, Nyman Jewelers, Everyday Wines and the Zephyr Wine Bar, Escanaba Movers, and Richardson Jewelers.
Thanks for joining us for this special program. I'm Cynthia Thompson. Breast cancer is the most common cancer diagnosed among U.S. women, with about 250,000 new cases diagnosed each year. Over the next half hour, you'll learn about new, different, and life-changing treatments that are available right here in the UP. We begin tonight with Local 3's Rebecca Bartolome, who explains who should have a mammogram and what role your family history plays.
Thinking about the possibility of having breast cancer can be a very scary situation, but local health experts say it's best to be proactive with early detection before it's too late.
There's different organizations that have different recommendations as to what age should start screening. So I would really recommend women contact their own healthcare provider for an age to know when they should start. Through the health department in our family planning program, we start screenings annually when a woman turns 40.
But based on genetics and family history, some people may need to start screenings earlier.
Individuals who have the BRCA genes, or BRCA1 and BRCA2, are at a very high risk for breast cancer, amongst other cancers as well. So we have very specific screening and management guidelines set aside for individuals who are known mutation carriers. We can also see that breast cancer happening much younger than we do for typical breast cancer diagnoses. So we usually start breast MRIs at around age 25, adding in mammograms by 30.
And it's not just women who carry the gene. It's not as common for men, but it can still happen.
Such that in men that have a strong family history of breast cancer and their mother, aunts, or uncles, or sisters, it's something that should be on their radar, and they should also see their doctor and talk to their doctor about their risk of breast cancer, because it is real and it's not something that should be ignored. Again, it's oftentimes of much more significance for a man with breast cancer than a woman, because it is later stage and more difficult disease to cure.
Rebecca McFalda is the only genetic counselor in the UP. She says over the years, genetic testing has changed.
BRCA1, BRCA2, those are the genes we know the most about. We've been testing for those for about 20 years, and estimates are anywhere from about 5 to 10% of all breast cancers will have a BRCA mutation. When we look at people with ovarian cancer, even some types of prostate cancer, metastatic prostate cancer, those numbers are more in the 10 to 15% range. So we look a little bit outside of just family history of breast cancer. We want to look at all the BRCA-related cancers to try to assess that risk.
The genetic test consists of a blood test, with the results coming back a few weeks after. The Marquette County Health Department has a few options for people interested in screenings.
The Breast and Cervical Cancer Control and Navigation Program, for short we call that BCC. That's a screening and diagnostic program for women. It used to be from age 40 to 64. They actually added a pilot program this year, so women as young as 21 can benefit from the program. So if there's anything found that needs follow-up, the program also pays then for diagnostics. And then there's other programs we can move people into if they need treatment for any issues that are found.
Saul says overall detection starts with the person being self-aware.
Seek care from their healthcare provider. If they notice any changes, anything that's unusual, don't wait, because early detection is really key.
We'll be back with more from the UP Fights Breast Cancer in just a moment. Stay tuned to learn about the technology used to detect or to rule out problems.